Hi, I'm Katrina Jarvis, and welcome to the Introduction to Substance Abuse. I'm going to take you to my micro lecture, which is about screening tools. So, weeks 3 and 4, welcome to assessment and diagnosis, screening tools, treatment approaches, and resources. But this micro lecture is going to focus on defining, exploring, identifying, and how to do a screening test. When you prepare and engage with your client, you want to be respectful, non-judgmental, attentive, and you want to motivate the client to identify their needs, how assessments are beneficial, and how they're going to reach their life goals. Establish trust with your client and develop rapport. Create an empathetic and warming environment. So, what is a screening assessment? It's a general overview of the process by which the counselor or clinician and client review the current situation. It involves symptoms, collateral information to determine the probability of a problem, like if someone is an addict, and it usually takes 20 to 30 minutes, or if someone suffers from mental health issues. But it is the first step before determining anything. So, screening requires informed consent, asking questions to determine a valid assessment, and acknowledging strengths and needs, relevant history, age, and demographics. And today, we're not encouraging a screen for mental health issues, but we're going to demonstrate a screen for substance abuse. There are lab tests such as urine tests and series of questionnaires and brief intervention. So today we are the clinician. So I was in the middle of a brief screener for tobacco, alcohol, and other drugs. And we're going along, and it's in this specific questionnaire, all the recent questionnaires asked in the past year, because the current questions are applicable to the client's needs in the moment. So it's asking how many days did you use amphetamines or methamphetamine non-medication? I clicked half. And this is not about me, but as if I had a client on the other side. In the past year, how many days did you use hallucinogens and mushrooms? And these are the type of questions that they're going to ask. So, depending on what you click and the necessary steps that they go in order, will determine the summary. So, over the counter medications that more than you were supposed to use. I'm just going to go with half. And it brings us to a summary. In overall risk level, this person is at a higher risk. The drugs that were identified, just like if it was a lab test, alcohol, marijuana, heroin, amphetamines, methamphetamines, hallucinogens, and over-the-counter medications. Now, any assessment could determine this if the client is honest. If it was a lab test, it would be the other way. Um, but this was specifically for adolescents reporting substance use in the past 12 months. And they are at risk for a substance use disorder. So here we scroll down, and where it's more significant is suggested clinician action. So we want to have to further assess to determine how to best manage care with this person. Maybe they need to go through an additional assessment. Maybe it's up to the counselor to make a diagnostic and statistical manual, DSM substance use disorder criteria. And we want to, obviously, this is where the action part comes in. We want to provide feedback, advice, facilitate goal setting by the patient regarding cutting back or abstinence. And at the patient's acceptance, a referral to counseling for substance use disorder. Ask if the parents know about substance abuse and ask permission to discuss the referral with them. And arrange a follow-up in a month to see if the patient has access services and give them additional resources. So there are also ones called CRAFT, and this, it's always an sort of acronym for a questionnaire. And I got this off SAMHSA, the National Institute of Drug Use. And we're going to go back to our micro lecture, and providers should always use tools that best suit their practice. So what's next? Maybe we develop a treatment plan. Maybe we include them in therapy. Maybe we let their family know. Medication-assisted treatment, helping them get off. One, in this case, it's not necessary, but we already covered medication-assisted treatment, and we focus on their goals and plans for the future regarding abstinence or cutting back. And that's all I have to say on screening tools. It was a quick review, and these are my references if you'd like to check them out yourself.